Right. I'm Payal, and today I'm going to be talking to you about integrated approaches to sustainable healthcare systems. Now, before I get on with the talk, a little bit about how I actually got here in the first place. So that's a family picture back in 1997, and I have my baby sister on my lap. Don't go on that picture, because apparently I wasn't the most pleasant kid growing up. And I guess my parents were not too wrong when they said that, considering I nearly burned down a house at the age of 8. And that was because I did not understand what a teacher meant when she said, clothes catch fire in a science class. So I went back home and I did my own experiment. I don't think I need to say that did not go down very well. But it just showed that I was a curious kid. And in my defense, that's what I told my parents. I was a kid. Kids are supposed to be curious. Nevertheless, I've been very thankful that they did not abandon me after that, and that's a picture from a recent holiday, well, recent as in 2017. Apart from fire, of course, the other thing that I had a lot of interest in while I was growing up was biology, and eventually the human body. I think the fact that my father was working in a pharmaceutical company also aided my decision of going into Bachelor of Pharmacy, then going on to nanomedicine, doing some work, and then doing PhD over here. Now, you see, when I started my education for a career, what I had in mind was to contribute to health using research. But along all this research work that I've been doing, the moving of countries and working in 4 different research groups, I realized a few things. I realized that healthcare is actually more than just one doctor, a patient, and a pill. It's like this huge jigsaw puzzle with so many tiny pieces in there. And today, I'm hoping to share some of my understanding, some of the things that I have realized over the years with you. Now, before we go on to understanding what is healthcare system, I think it's fundamental that we understand what is health at the very basic level. So according to WHO, or the World Health Organization, health has been defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease. WHO also says that the highest attainable standard of health is the fundamental right of every human being, irrespective of the background. The other thing that they mention is that health is important for peace and security of a place, and that cannot be achieved without the complete cooperation of both people and the state. Now, you'll notice that I've underlined a part of that sentence, and I want you to keep that in mind, because we'll come back to that a little later. But as of now, we have established that health is fundamental. Now, if it is something that is so important and so fundamental, it makes sense that we have a system that is dedicated to ensure that people of the system are healthy. And this is where our healthcare systems come into place. Now, healthcare systems include people, include healthcare services, and they include policymakers. People like you and me who work in the system, who have used the system, and I'm very sure all of us in this room here knows at least someone who has been a doctor or a patient, who has done biomedical research, donated blood even maybe. Next comes the healthcare services. Now, this is where the primary healthcare work gets done. These are our hospitals, these are our path labs, these are our clinics, and there are about 60 of these centers in Leeds. Last but not the least, we have our policymakers, and these are people who have to ensure that they are aware of what has been happening in the system, and they come up with policies that ideally should be beneficial for people and the systems. Having said all these things about healthcare systems, the one thing that we need to really acknowledge is the fact that there is a huge divergence in the quality and the level of healthcare that is accessible to people across the globe. Now, this map right here shows us the life expectancy of a person, that is the number of years you're expected to live at the time of your birth across the globe. We can see there's a variation indicated in the color red, which is the lowest, about 50-ish, and then goes up to a highest average of about 85. Now, while the divergence is quite clear, the good news is the number of years we are living today is the maximum number of years we have lived today, until today. And that is a huge thanks to scientific advancements, things like artificial intelligence, gene therapy, stem cells, nanoparticles. Their potential is boundless. That is what excites me, it blows my mind, and that is exactly why I'm in the field. Now, you would think that the fact that the life expectancy has increased and we've got so many more innovations, healthcare should be doing all right, right? How bad can it get? But when I take a closer look at the healthcare scenario, it screams a very different picture to me. To begin with, 71% of people die every single year because of lifestyle disorders. Now, lifestyle disorders is an umbrella term used for conditions that have culminated as a result of poor diet choices, lack of exercise, sedentary lifestyle, excessive alcohol, excessive smoking. So basically, 71 out of 100 people die every year across the entire globe because of their own choices. That is also the highest cause of mortality in totality. The other pressing problem that comes up is multi-drug resistance. Now, when we have a bacterial infection, we are given an antibiotic. If the antibiotic is not able to kill or stop the bacteria, it's called antibiotic resistance. When multiple drugs cannot do the job, it's called multi-drug resistance. As of now, multi-drug resistance is killing 700,000 people across the globe every single year. But apparently, by 2050, it'll be MDR and not lifestyle disorders that will be the leading cause of mortality. It's like these two are having a competition here. I don't even know which one's worse. If that was not enough, we've got 800,000 people committing suicide because of mental health issues every single year. Now, you see, the thing with the previous two problems is that there's some kind of diagnostic test that can tell us, okay, there's a problem. But when we are under mental health problems, we take a while to understand, then acknowledge, and then eventually get help. There's a series that we need to go through to get to the level where we can get help. Along the same lines of problems is the fact that we've got a lot of increase in age-related problems. Because as a globe, we are aging. That's actually the fourth picture right there. And if there are two patients who have got the same problem and need the same kind of medication, but one is 25, the other is 65, their approaches need to be different. And from literature, I can tell you that we are not yet suited for that kind of change. We are not yet being able to adapt to that kind of expectation. The final two problems is basically what reminds me of how big healthcare systems are. Last ones being, it's a major consumer of energy and resources. Well, of course it is going to consume energy. There are people, there's food being made, there's biological waste, there's clinical waste, there's water running, there's gas running, there's electricity. There's so many things happening all in one place. Of course, it's going to consume energy. Apparently, in 2015, the energy consumed by the entire NHS England alone was more than the energy consumed by the entire country of Croatia. And that's not even the worst part. It gets a bit darker. So some parts of the developing countries have hospitals or have healthcare systems that cause pollution, that have got waste and that causes pollution. It makes the people living around the hospitals ill, and then they go back into the system for treatment. It's a vicious cycle that needs to be cut somewhere. And the last pressing problem that I'm going to be discussing with you about is hidden costs. Now, hidden costs is situations wherein a patient loses his or her life because of a diagnosis gone wrong or a treatment gone wrong, administrative costs, the time and money lost moving a patient from hospital to hospital or from one ward to the other, missed opportunities. These may seem like small things, but when put together, Feinberg found that they cost over $700 billion every year. And then we asked, where did the money go? Now, I come from a country of 1.3 billion, 1.35 billion. I may understand what that number may be like. I don't know what 700 billion is like. When I try to ponder upon all these problems all together, it screams to me that the care from the healthcare system is fading away. And if this is the rate at which we continue, we will not even have the health. All we are going to be having is systems and its problems. So how do we come about building a healthcare system that is sustainable, that is able to survive the test of time? I'm going to be talking about the sustainable healthcare approaches here. There are going to be three approaches: system-based approaches, people-based approaches, and general approaches. When it comes to system-based approaches, prevention was, is, and will always be better than cure, hands down. But the thing with prevention is, what do we prevent? If you want to prevent something, we need to have enough knowledge about preventing it. For example, now that we know there are so many people dying because of lifestyle diseases, we can start educating primary school children. This is a balanced diet. These are the kind of exercises you can do based on your interest, based on your body size, anything of that sort, so that you can lead a healthy life. That will definitely bring down the number of people who are dying because of lifestyle disorders. But we can do that now because we've got solid research, we've got solid data, there's enough evidence out there, these things can lead to so-and-so conditions. And this is where research comes in place. Now, in my 7 years of biomedical sciences, my PhD in Leeds is the first time I've actually been able to work in collaboration with hospitals. I don't see that happening everywhere, and especially not in different parts of the world. There are too many people dying, there are too many things that need to be taken care of in healthcare. And if academia, industry, and hospital do not join their hands together, we are never going to be able to find a solution to these problems. And the sooner we understand that, the better. Once we get used to this research, that is when we'll be able to predict what may happen in future. Like now we know we need to have systems that is more sensitive to a certain age group. And this will help us adapt. As human beings, we need to adapt if we want to survive. And if a system needs to survive, they need to adapt as well. Next, coming on to people-based approaches, because yes, there's a system, but it's the people who are running the system. Considering that there is an average of 2.8 doctors for up to 1,000 people, yeah, that's the ratio, 2.8 doctors for up to 1,000 patients in the developed part of the world. In developing countries, it goes worse. Considering that that's the ratio, not only do they need to be very skilled, of course, they also need to be very efficient. It's not fair on them, but that is the current scenario. The one thing that might help there is if every healthcare system had voluntary, certified volunteering. What that would do is we would have people with helping, because they would be trained, of course. There would be people at hand who will be able to provide the help, and they would get something to put on their CVs, because there are people who want to make that impact. The next thing that we come to is impartial. We have already established that health is fundamental, and there should not be any distinguishing between people, irrespective of the social or economic background. The last one on this one is accountability. So when I spoke about the examples of patient losing their life because of a wrong diagnosis or wrong treatment, people who have taken the decision need to be answerable for it, because then that situation needs to be discussed properly, and the next generation of professionals coming will know that something like this can happen. Just transferring that knowledge can prevent so many other accidents, and that needs to be taken into account. Last is going to be the general approaches. And the first one in that is it needs to be safe for the earth. I mean, come on, we cannot have a healthcare system that is making its own people ill. That negates the whole idea of having a healthcare system in the very first place. Next, what we need is networks for social care. So these will be something like open community centers, It's got place for people to come and have a coffee, you can have a chat, there's activity center. So that people who are trying to deal with things like loneliness, who are trying to deal with mental health issues, they have somewhere to go to without being judged. You know that saying, catching up with your best friend is cheaper than therapy? Unfortunately, I think it's got a much deeper meaning to that. And finally, I'm going to talk about affordability. And I'm talking about that because we're talking about global health. Not every country in the world has got access to free healthcare. And that is why it's important that, irrespective of what background people come from, they're able to get to that part of the medication and health they need. The best example I can think of is definitely mobile health, or mHealth. Now you see, mobile phones have reached places in the world where many things have not. And that's what is so empowering. Using these as a medium to educate people about the prevention, about the different causes of different kind of problems, has become very popular. And not just in the developing countries, but also in the developed countries. These are different approaches that need to happen at the same time to be able to see an impact so that we can have a system that is sustainable. This is why I think that this is how our sustainable healthcare systems need to be in order to survive the test of time. But then how about us? We are sitting and having a conversation here. Well, one-sided conversation, but conversation nevertheless. What about us? What do you think can we do? And you remember this point I told you to remember? We cannot get to that point of peace and security using health if there's no cooperation. What do you think doctors and nurses say when we ask them about these problems? The first thing they're going to tell you is there's 50% of patients do not even comply to what they have been told. One of the biggest problems, one of the most prominent problems about this is having drinking problems. And no, I'm not talking about Friday drinks or a drink after birthday or celebratory drinks. I'm talking about people who have been medically been informed, please do not have that one drop of alcohol because your liver is damaged. People like some of them, go ahead, do that self-damage. That's one indication that they're doing that again. That means there's another level of care they need. And they come back to the healthcare systems. That costs the healthcare system money, time, and resources. If we do that, we are the healthcare burden. We are causing more burden than what already is. The other thing that actually cropped up when I was looking into these things was that about 20% of people, 20% of outpatients to be precise, don't even have any problems and they're actually just hypochondriac. Now again, we have long waiting times here. Googling up things because we want to understand what's wrong with us is not what I'm talking about. These are people who have found something on the internet and they've gone to the doctor saying, this is the treatment I want, which will be the most expensive treatment. Without having any tests done, they will actually say, if you don't do this, I'm going to complain about you. If we are doing that, we are also causing the healthcare burden to increase. As human beings, we are just so quick to criticize something. We're just so quick to say this is not right and that should not be done. But let us not forget, it's our system and our health is pretty much in our hands. Unless and until we have a condition that we have no control over, it is us who needs to take care of it. It is us who needs to realize what needs to be done. And as cliched as it may sound, fresh fruits, fresh vegetables, balanced diet, plenty of water, yoga, Zumba, catching up with your friend, going for a hike, it will help. There's a reason why people make these clubs. There's a reason why we go out and do these things in the first place. I love Zumba. That keeps me going. What is it that you like? And sometimes what happens is that we are dealing with more than one situations. And there's plenty of evidence saying that how physical activities can impact our mental health and vice versa. Sometimes it can be hard, but then reach out. If you know someone who needs help, reach out to them. If you are someone who needs help, reach out to them. The healthcare system is for us. It begins with us. Let us try and do this for a better tomorrow. Thank you.